next major importance of ICD 10CM. See, ICD 10CM is not just assigning codes, not just simply assigning the codes. Here you should know the sequence, which should be reported as primary, which should be secondary. That sequencing is all the more important, and most of the guidelines talk about the sequencing rules. What is actually a primary diagnosis? What is a secondary diagnosis? And how about coding sign and symptom? So you should know before that what is a sign. A sign is an objective finding that is being evaluated by or that is being observed by a doctor or a healthcare provider. A symptom is a subjective experience of the person or the patient. So a symptom is subjective, a sign is objective. So with these signs and symptoms, a doctor arrives at his final judgment, which is the diagnosis or the condition, the tentative condition, or it's a assessment or an impression. So while coding, we encounter so much of signs and symptoms. Say for example, a patient presented with abdominal pain, and then it was found yesterday he might have had hotel food, and that had resulted in his abdominal pain, and he's passing like loose watery stools. So this could be a case of a gastroenteritis, and if the doctor diagnoses a case of gastroenteritis, now you are not supposed to code the abdominal pain, because pain here is a symptom of gastroenteritis. After investigations and study or culture, they find out that actual cause is there is inflammation of the small intestine or the stomach mucosa, and thereby the patient had abdominal pain. The abdominal pain is a symptom, gastroenteritis is a condition or the diagnosis. So when you have this in your medical record, the rule says you don't have to report the symptom. That's what it says. Okay, but here you should understand signs and symptoms that are integral part of the disease and signs and symptoms that are not integral part of the disease. Here, for example, see, abdominal pain is related to the condition, so you can very well report that only the diagnostic condition. But what if the patient has knee pain and ankle pain, severe ankle pain? Here, these are not related to the definitive diagnosis. So in this case, you can very well report the unrelated signs and symptoms of gastroenteritis, because gastroenteritis does not have anything to do with your ankle pain or a knee pain. It could be due to some other problem, let's say an osteoarthritis or an acute injury. You should figure out whether this sign and symptom is part of the definitive or the related diagnostic condition. If it is part of it, you don't have to report, and if it is unrelated to it, you can very well report it.